This brief introduction video details correct application of the TAGecg sensor, including patient preparation and education tips to ensure optimal sensor wear time up to the full 7 days. Please read the TAGecg operator's manual, quick start guides, and the TAGecg sensor pouch label for important information before use. Note the complete list of patient indications and contraindications for use, as well as detailed product specifications. The TAGecg sensor is a professional medical device prescribed on the order of a physician. The TAGecg sensor is indicated for use on adult patients who may be asymptomatic or who may suffer from transient symptoms. These symptoms include palpitations, dizziness, anxiety, fatigue, syncope, presyncope, lightheadedness, shortness of breath, or individuals who are at risk of developing atrial fibrillation, where a software-assisted analysis of an ambulatory ECG could identify potential cardiac causes of these symptoms. Prepare a clean surface where you can set up the sensor and supplies, and double-check that you have everything you need. The TAGecg sensor pouch contains the skin preparation supplies needed, with the exception of these supplies: non-permanent ink pen to mark patient's skin, non-sterile latex and powder-free barrier gloves, an extra supply of alcohol and 4x4-inch non-sterile gauze pads, wet, dry electric clippers, safety razor or shaver as needed for hair removal. Patient education. Verify that the patient has no known allergies or a history of adverse reactions to hydrogel adhesives. Verify that the patient does not have an implantable pacemaker or is scheduled for an MRI procedure. Verify that the patient is not planning to participate in strenuous activity, including at work, that would cause excessive sweating during the sensor wear period. Ensure the patient understands that there is no swimming or immersion bathing while wearing the TAGecg sensor. Patient skin inspection. With the patient seated comfortably upright with shoulders back, inspect the patient's upper body shape as well as the condition of the skin area just below the left clavicle or collarbone. Observe and locate key anatomic landmarks of the left chest, including the sternum, the left clavicle, and breast size. These factors will help you adjust sensor placement to the patient's body size and shape. Ask the patient about their typical sleep position, back, left, or right side, and about any occupational or other considerations that help you determine best sensor placement. Skin preparation. The most important factor in sensor wear time and good ECG signal quality is thorough skin preparation. The patient's chest skin must be intact, clean, dry, and free of any oils, lotions, or powder, or body hair before you apply the TAGecg sensor. Hair removal. Remove all chest hair growth in the area of the sensor placement on the left chest, including a full 1-inch margin beyond it. Wet shaving with electric clippers is preferred as it typically reduces skin irritation, which improves sensor wear time and comfort. Application template. Before you prepare the skin, use the provided application template to estimate the sensor placement area on the patient's left chest and consider the following placement alternatives. There are 2 general TAGecg sensor placement options based on ECG lead approximation. Placement option 1 approximates the lead orientation of lead 2 of a standard 12-lead electrocardiogram. In this orientation, the sensor is placed diagonally and is the preferred position. For option 1, place the right electrode at the second intercostal space next to the sternum, and the left electrode at the third or fourth intercostal space. Placement option 2 is aligned with lead 1 of a standard 12-lead ECG. For option 2, place the sensor horizontally at the third or fourth intercostal space, with the right gray electrode placed proximal to the patient's sternum. TAGecg sensor placement considerations. Avoid locating the sensor over the patient's left breast tissue or into the patient's left armpit. If needed, place the sensor closer in towards the patient's sternum and slightly higher. Placement too far into the armpit or over mobile breast tissue can cause sensor lift, degrading both sensor adhesion and wear time. This video demonstrates how to place the TAGecg sensor in the option 1 diagonal position. Skin preparation. Cleanse skin with alcohol. Use the provided alcohol pad and extras if needed to wipe clean an area at least 1 inch larger than where you are going to place the sensor. Let the skin dry for 30 seconds. Locate placement and mark the skin. Use the application template again to locate the selected placement area. Using a non-permanent pen or marker, mark 2 X's on the patient's skin that correspond to each of the holes on the application template. These X's are where the 2 gray circle electrodes of the TAGecg sensor will be placed. Next, mark dots or short lines along the outside border of the application template to identify where you are going to stick on the TAGecg sensor. Abrade the skin. Select one of the 2 provided skin abrasion pads in the patient's supplies. Our model will demonstrate how to prepare the patient's skin using the sandpaper-type skin abrasion pad. Rub gently only over each of the 2 X's marked on the patient's skin, using a circular motion, and abrade over each X only once. This will loosen the top layer of dead skin cells, and it is a very important step. This may cause mild stinging and erythema, but this irritation should subside. Wipe skin with dry gauze. Use the sterile dry gauze sponge, and more is needed to wipe the sensor entire placement area to remove any remaining dead skin cells. Place the sensor on the patient's chest. When applying the patient's TAGecg sensor, be sure the patient is comfortably seated, upright with shoulders back. Remove the TAGecg sensor from its pouch package, but do not remove the clear release liner flaps on its back. Holding the sensor with the clear liner side close to and facing the patient, unpeel and apply the first exposed gray electrode to the corresponding X you marked on the patient's skin. Press over and around this side in a firm smoothing motion, taking care not to wrinkle the outer adhesive border. Next, hold and pull to remove the remaining clear flap of the release liner, again matching the gray circle electrode area to the X on the patient's skin. Press around the white sensor cover firmly and smooth out the clear adhesive border against the skin. Lastly, with your index finger, trace around all sensor edges with your finger, smoothing as you go. TAGecg sensor activation. Ask the patient to remain still and press the sensor button once to activate sensor recording. If the TAGecg sensor has been activated successfully, you will see the following. First, a green light will flash quickly for about 5 seconds. Second, this green light will turn off for another 5 seconds. Third, the green light will start flashing again in the same rhythm as the patient's heartbeat for about 10 seconds. Fourth, the green light will then turn off completely. Record the date and time on the patient's medical record immediately after the green light turns completely off. This is the patient's recording start time. You may also wish to write the recording start time on the front of the patient's diary or on the patient's sensor pouch. You will need to enter this information into the TAGecg software, TAGecg, when processing the sensor electronics module for ECG analysis. The TAGecg sensor application and activation process is now complete. Sensor placement and activation troubleshooting. If you do not see the light sequence as described, or if you see an alternating red-green light flashing sequence, the device is not making good contact with the patient's skin and has not been activated. Press down again over and around the sensor and the surrounding adhesive. Wait a few minutes and repeat the button push above. If the green light still does not flash and turn off, remove and return this sensor to its pouch and apply a new sensor. Patient trigger button. The patient should be instructed to press the sensor button if they experience symptoms such as palpitations, irregular heartbeat, dizziness, anxiety, fatigue, faintness, lightheadedness, shortness of breath, or anything out of the ordinary. A green light will flash for 10 seconds after the sensor button is pressed. For the best recording quality, the patient should remain still during and immediately after pushing the sensor button. Instruct the patient to write in the provided patient diary if they experienced any symptoms and push the button, particularly noting the date and time. Showering while wearing the TAGecg sensor is permitted. However, instruct the patient to keep total shower time brief and to avoid a continuous direct water spray over the sensor. Remove the TAGecg sensor. After a TAGecg sensor wear period of up to 7 days of continuous ECG recording, the sensor is ready for removal. Use the provided adhesive remover pad that is attached to the patient diary insert, or use Vaseline or baby oil to wipe between the adhesive layer and the patient's skin as you peel the sensor off gently and slowly. Support the skin and avoid unnecessary pulling or tugging to avoid skin injury. If any residual adhesive remains on the skin, apply petroleum jelly or baby oil over it and let it sit for about a minute. Wipe the jelly or oil with tissue paper or a gauze pad. Repeat as needed. Instruct the patient it is normal to experience minor skin irritation and a slight odor after TAGecg sensor removal. This should disappear after a few days. Your practice should be contacted if skin redness, with or without itchiness, persists over several days or according to your clinical protocol. Remove TAGecg electronics module from its adhesive cover. To access the TAGecg electronics module for in-office ECG data analysis, you will first need to remove the sensor's adhesive cover. Place the removed TAGecg sensor, adhesive side down, onto any appropriately sized piece of paper. Pull upwards on the tab of the sensor's foam cover to reveal the electronics module. Remove the electronics module completely from the adhesive attaching it to the bottom layer of the sensor. Discard everything except the electronics module, according to local regulations. Be sure to document the electronics module serial number on the patient's medical record for identification purposes. The electronics module contains the patient's complete ECG recording, up to 7 days. You are now ready to transfer the patient's ECG data to produce a draft report for clinical review and verification in about 5 minutes. Refer to other detailed instructions and educational videos on transferring ECG data and reviewing the patient's draft summary report using TAGecg software. This can be done conveniently and securely right in your clinical setting. With attention to good skin preparation and patient education, the TAGecg sensor can optimize ECG data collection, patient comfort, and compliance. The TAGecg sensor also reinforces the importance of the clinician-patient care relationship by supporting all steps of the diagnostic process conveniently in the practice setting, which can shorten the time to diagnosis and treatment.